Abby.
Hello.
Hello.
It's nice to see you.
Nice to see you guys.
We're going to let you chat.
All right, awesome. Well, this is my third parent trip now, which is really exciting. I'm Abby. I'm a pelvic floor physical therapist, also an orthopedic PT at West Portland Physical Therapy Clinic. So we are located at Southwest Morrison and 17th, which is actually right next to Providence Park. So kind of downtown near the Max station. We also have a parking lot. A lot of people are pretty relieved to know that there's definitely going to be a space where they can park when they come to see us. So there's that. I am one of our 6 pelvic floor physical therapists. I've been a PT for a couple of years now, and pretty much ever since becoming a licensed therapist, I've been kind of studying under some mentors and taking continuing education classes to really specialize in the pelvic floor. And I'm super happy that that's what I'm doing. So just as far as kind of how our clinic is operating right now, if anyone's ever been there before, it's a super busy clinic. We normally have a lot of, physical therapists, support staff, front office staff to really operate the place. We have 2 levels as well, 2 gyms, a bunch of private treatment rooms. So kind of, with the pandemic and everything, we've had to scale back a lot. So we've been slowly kind of building back our staff over time. Normally we're open Monday to Saturday, but right now we're kind of just doing a Monday to Friday thing. We have 5 out of our 6 pelvic floor physical therapists back, which is great. And then obviously we're just trying to follow the precautions as much as possible. We've kind of taken away the waiting room. We've staggered our schedules. So there's less foot traffic. Everyone gets taken to their private room right away after being screened and temperature taken. All of us therapists take our temperatures, and of course, everyone's wearing a mask. And things have gone pretty smoothly, which is really great. But for anyone who isn't comfortable coming in, which is totally fine, we also have the telehealth option available, and that's started to run a lot more smoothly the more that we've been using it. So that's super exciting. And yeah, we're just trying to slowly and safely build back to what we had before, again, as safely as possible. So as far as pelvic floor physical therapy, a lot of people don't actually know much about their pelvic floor or what we do with pelvic floor PT. If you've had any experience with kind of traditional orthopedic physical therapy, it's a little bit different. So a lot of, kind of the main thing that we do is teach people about their pelvic floor and how to use it. We never really get taught about our pelvic floor until something goes wrong, which is kind of unfortunate, but I guess that's what I'm here for. So I brought home our little 3D pelvic model that we show all of our patients at their evaluation before we do any sort of work. After we kind of get their subjective and learn about what's going on, we bring this girl out and we kind of just give a little anatomy lesson, kind of how the symptoms relate to the anatomy and kind of how we do our assessment. I'm going to give a really short little condensed version of that just because of time. But just to orient everybody, kind of this is your pelvis. So super complex area, the front here's kind of the back. So just to kind of start with the little structures, this is kind of the end of your spine. So your last lumbar vertebrae up here into the sacrum. You have your ilia or hip bones on either side, which connect to the sacrum to make the sacroiliac joints here. And then your coccyx or your tailbone at the end of the spine. So coming around here, these are your little sit bones. So kind of what you feel when you shift your weight back and forth in your seat. You have the hip joint here, so the long bone, the femur, comes in and connects there, pubic bones in the front, and then this pubic symphysis joint, we call it, in the middle. So all of this red is your pelvic floor muscles. You have 3 layers of muscles, a lot of different little muscles involved, and they kind of connect to all of those structures I just pointed out. So kind of the end of the sacrum, they anchor through the tailbone, on either side to your sit bones, and in the front to your pubic bones. So there's your pelvic floor. But what does your pelvic floor do? So what we like to define your pelvic floor's function is with the 5 S's, we call it. So 1 is support, the first S. So as you can see, kind of internally are all your pelvic organs. So you have your bladder here, your uterus, and then the rectum in the back. And your pelvic floor kind of sits like a little hammock underneath those organs, supporting them physically, but kind of also supporting them with their function as well. The second S is stability. So along with kind of your other big muscle groups around the area, including kind of the deep core muscles up here, the hip and glute muscles, the deep back muscles, they all coordinate and work together to kind of keep this whole area as stable as possible. Kind of what with all the pressures running through the system, it's the area that kind of connects your upper body and lower body. So having all those muscles, muscle groups strong and coordinated is super important for keeping this whole area stable. Third S, sexual. So sexual function it helps with. So your muscles are able to kind of contract, relax, bring blood flow to the area to help with sexual pleasure. And then sphincteric, that's another function. You have a couple of different muscles that kind of open to relax and close to contract to kind of, either retain or expel your bowel and bladder contents when necessary. And then the fifth one, we call it a sump pump. So basically what that means is kind of the contractions, relaxations of the muscles also help to move blood through the system, lymph, fluid, that kind of thing. So that's kind of, my very quick spiel. And when it comes to kind of your pelvic floor and pelvic floor physical therapy, it's kind of a common misconception that we only treat postpartum women, because we actually treat, women at any stage of pregnancy. And then we also treat, anybody outside of pregnancy. So we see women, yes, we see men, we see children even for pelvic floor dysfunction. And that can include, any dysfunctions with your bowel and your bladder control. So that could be, urinary urgency, urinary incontinence or leakage, even the same thing kind of with fecal matter, constipation, those kinds of things. So we treat that for anybody. A lot of pain with intercourse we treat as well. And then, chronic pain conditions, including endometriosis, interstitial cystitis, and then any sort of chronic pain around the area, which can include kind of the genitals, the hips, abdomen, lower back, all of that. So that's just kind of an overview generally, but then kind of when it comes to perinatal, it's not as common, I think, to see patients while they're pregnant, but we do that a lot, and it really is super useful to kind of come in and learn about your pelvic floor muscles before giving birth, because it really kind of sets you up for a better recovery afterwards. If you don't end up doing that, that's totally fine. We can always help afterwards, but some things that people kind of come in with prenatal is, our body's really changing in these stages, new pressures in new areas, hormonal changes that are causing kind of hypermobility of the joints. That can lead to kind of some pain, lower back pain, hip pain, pubic symphysis pain as well, just because there's a lot more mobility in the joints and our muscles are getting weaker over time. So they're not doing, their jobs of stabilizing. So we do a lot of kind of learning how to use our muscles to stabilize that area so that you aren't having that pain when you're walking around. And then kind of learning how to use your pelvic floor as well. Sometimes bowel and bladder stuff occur just because either your pelvic floor muscles are tensing up to really kind of take more of that weight, or they're getting stretched out as well. Kind of learning how to use those muscles to help with the stability, and then kind of really learning, the main thing is learning how to coordinate your muscles, knowing what it means to contract your muscles or do a Kegel, knowing what it means to relax your muscles, and then especially knowing what it means to kind of bear down and push your muscles so that when you're delivering, you have that confidence and knowing, yes, I'm doing the right thing with my muscles to kind of help open things up and push the baby out. So we do, a lot of educating on how to do that. We help people find good positions that really help to relax their muscles for during labor and during delivery as well, kind of different positions. Everybody kind of has their own preferences and stuff and what their muscles like. So finding those positions. We also do a lot of teaching patients how to kind of stretch through the perineal area prior to delivery to kind of, it's quite common to have at least a little bit of a tear kind of in this region, the perineal tear. So learning how to stretch this area to mobilize it a little bit more to kind of prevent as much of that risk of tearing as possible. We can't guarantee that we're preventing any tears, but kind of the severity of the tear as well. is something to think about. So um, yeah, something cool to mention as well is that we have a pregnancy pillow, which most people find really comfortable. It allows, you to lay on your stomach for even the later stages of pregnancy. That way we can kind of work through, the backside as well with some of the manual therapies if needed. But that's just something I wanted to mention. And then, yeah, for postpartum, one of the big things that we do is, all of those same things. You can end up with the same muscle and joint pains, even nerve pains. There is that separation of the abdominal muscles or diastasis that can happen. So we kind of work on bringing the tissues back towards the front and from the low back, getting those deep core muscles to help tension and stabilize that area, mobilizing the perineal scars if that happens so that you don't have any long-term tightness or pain in that area. And then again, yeah, retraining the pelvic floor muscles to strengthen if needed, to kind of relax if needed as well, if they were in a lot of tension. Pelvic organ prolapse is also something to consider, where some of the walls between the pelvic organs can get a little bit weaker and kind of fall into each other. So kind of strengthening the muscles to help support those organs. And then what else? Yeah, one fun thing is kind of learning how to use your own body and making sure that you're safe with baby care. So like learning how to use your hips to lift the baby out of the crib as opposed to your back, making sure, yes, that you have good posture when you're breastfeeding so you don't end up with a lot of neck pain and kind of shoulder pain with doing this hunching over thing. We do see that all the time, like Sarah mentioned. So and then lastly, kind of returning to any sort of exercise or activity, as safely as possible, and making sure that your pelvic floor is protected with any sort of exercise. And yeah, lastly, I just wanted to say, I think I'm almost out of time too, that yeah, we know that it's really hard to kind of take time for yourself as well and kind of, come in, every week for however long and take yourself away from the baby. So we do encourage, one, we kind of meet you where you're at. So any sort of schedule where you're able to come in more consistently or less consistently, we can work with. We can give you more stuff to do at home if you can't come in as consistently. And then you can always bring the baby in with you. It actually helps us to see how you're moving around with it. And we can kind of give you tips on kind of better body mechanics. And then if we ever need to kind of do our own treatment sessions and stuff like that, we have support staff that can kind of sit with the baby in the room with us or kind of take the baby around on a tour of the clinic. We have a lot of toys at the clinic too. So usually, yeah, that always works pretty well. So I just wanted to mention that. But yeah, I think I've gone past my time maybe. So yeah, that's pelvic floor PT.
Thank you. That was so much information. So,
I know.
yeah, no.
It's hard to condense it all, but I hope it wasn't too overwhelming or anything.
No, I mean, I think it's all really important for us to hear. And, like, this is something we just don't talk about enough.
Yeah, for sure. Exactly. And yeah, so yeah, we're here for anyone. Usually we kind of have able to get in same day appointments or next day appointments. So there's really not that long of a waiting list or anything, just for everyone to know. And you can always call with questions and talk more about kind of what an assessment would look like and treatment and stuff like that. So yeah.
Awesome. Thank you so much.
Yeah, thanks for having me.